Want to learn about breast cancer stage and the different types of breast cancer? We're going to teach you all about it.
Our bodies are constantly sending us signals, but often we fail to recognize the subtle clues they provide. While many are quick to notice common symptoms like pain or fatigue, there are other, more discreet signs that could be just as important, such as the odors we emit. Body odor, breath, and even the scent of sweat might seem like mere inconveniences, but they could actually be telling us something far more serious, like the presence of cancer. This is no exaggeration. In fact, today, we'll dive into the medical details of how you can diagnose yourself earlier with simple observations. Here are 8 cancer smells that people don't pay attention to. Let's get started. Number 1. Mold or rotting wood. The smell of mold or rotting wood is often an unmistakable odor that most of us associate with decaying organic matter. However, when this scent appears in your breath, especially as a persistent or unusual change, it can signal something much more serious, such as mouth or throat cancer. Mouth and throat cancers, also known as oral and pharyngeal cancers, can affect the tissues of the mouth, tongue, gums, throat, and the voice box or larynx. Like all cancers, mouth and throat cancers begin when cells in these areas of the body start growing uncontrollably. This abnormal growth leads to the formation of tumors, which can disrupt normal bodily functions and lead to various symptoms. One of the most common symptoms of mouth or throat cancer is a change in the odor of a person's breath. This change can range from a sour or metallic taste to more specific, alarming smells, such as that of mold or rotting wood. The reason for this odor is often linked to secondary infections, the death of cells and tissues, or the volatile organic compounds that are released by the cancerous tumors themselves. As tumors in the mouth or throat grow, they can interfere with normal tissue function, leading to the death of surrounding healthy cells. This necrosis, the process by which tissues break down, can release compounds that create strong, unpleasant odors. In the case of throat cancer, where tumors may block normal airways, necrosis can also lead to an infection in the affected area. Infections in the mouth or throat, especially when they are left untreated, can cause the tissues to deteriorate further and produce smells that resemble mold or rot. This is often seen in cancers that affect the sinuses, tonsils, or pharynx, where mucus accumulation and bacterial overgrowth contribute to the foul smell. Moreover, a study published in the Journal of Breath Research explored the presence of VOCs in the breath of patients with oral and throat cancers. The researchers found that specific VOCs, such as acetone, isoprene, and certain aliphatic hydrocarbons, were significantly elevated in patients with mouth and throat cancers compared to healthy individuals. These VOCs are thought to be byproducts of the altered metabolism in cancerous cells, which can then be expelled through the breath. Several studies have investigated the connection between cancer and abnormal odors. In 2015, a study published in The Lancet Oncology explored how the presence of VOCs could serve as biomarkers for diagnosing cancer. The study found that volatile compounds in the breath, such as those produced in mouth and throat cancers, were detectable through specialized instruments or even by trained animals, like dogs. These VOCs can vary by the type of cancer, and in the case of mouth or throat cancer, some of the chemicals released can create a smell resembling mold or rotting wood. One particularly compelling piece of evidence comes from research conducted by Dr. Michael Phillips at the Institute for Respiratory Research in New York, which showed that the breath of cancer patients could be used to distinguish cancer types. His work has led to the development of electronic noses, which are devices that can analyze the VOCs in breath samples and detect specific cancers. While the smell of mold or rotting wood can be alarming, remember that a persistent change in breath odor, particularly in the presence of other symptoms such as pain, swelling, or difficulty swallowing, should not be ignored. Early-stage mouth and throat cancers can sometimes be asymptomatic, but when symptoms like bad breath, persistent sore throat, or difficulty chewing and swallowing occur, it is crucial to seek medical evaluation immediately. Diagnosing cancer in its early stages greatly increases the chances of successful treatment. If the tumor is localized and has not caused significant tissue damage or metastasis, treatment options such as surgery, radiation therapy, and chemotherapy can be very effective. This may sound scary, but it can be a lifesaver, so pay close attention. Let's move on. Number 2. Decomposition. While the smell of decomposition is most commonly linked to decaying animals or rotting food, when it appears in the human body, particularly in the breath or stool, it can be a serious and alarming sign of an underlying health condition. In the case of colorectal cancer, this decomposing scent may arise due to the complex and often distressing metabolic processes within the digestive system. Colorectal cancer affects the colon or rectum, parts of the large intestine. Like all cancers, it begins with the abnormal, uncontrollable growth of cells that form tumors. These tumors can disrupt normal functions in the digestive system, leading to a variety of symptoms, including changes in bowel habits, weight loss, and unusual smells. The digestive system is essential for breaking down food, absorbing nutrients, and eliminating waste. But when a tumor forms in the colon or rectum, it can interfere with this process. It can cause blockages in the intestines, disrupting the normal flow of digestive materials. This blockage leads to the stagnation of food particles and waste, allowing bacteria to thrive and produce toxins and gases. These toxins, which are often byproducts of bacterial fermentation and the breakdown of undigested food, can create unpleasant odors. The smell of decomposition, often described as a foul, putrid, or rotting scent, can arise from the gases and other volatile compounds that are produced in the intestines as a result of this abnormal breakdown process. One of the most significant culprits of the decomposing odor associated with colorectal cancer is hydrogen sulfide, a gas that is often described as having a rotten egg smell. Hydrogen sulfide is produced by the breakdown of proteins and other organic matter in the intestines. When the colon is obstructed, this process is accelerated, and the concentration of hydrogen sulfide and other sulfur-containing compounds increases. The result is an intensely unpleasant odor that can escape from the body in the form of foul-smelling gas or stool, both of which are common symptoms of colorectal cancer. Ammonia, another gas produced during the digestive process, is also linked to the smell of decomposition. Ammonia is a byproduct of protein breakdown and can be toxic when it accumulates in the body. When the colon is unable to eliminate waste effectively due to a tumor or blockage, ammonia levels can rise, contributing to the decomposition-like smell that may be emitted by the breath or stool. A 2017 study published in the Journal of Breath Research analyzed the breath of patients with colorectal cancer and found that certain gases, including ammonia and hydrogen sulfide, were elevated in patients with the disease. In a separate study, published in Scientific Reports in 2018, researchers demonstrated that colorectal cancer patients exhibited specific changes in the microbial composition of their gut microbiota. These changes were associated with an increase in the production of gases like hydrogen sulfide, further linking the decomposition smell to the disease. The study also found that the smell of decomposition, when combined with other symptoms like unexplained weight loss or blood in the stool, could be a key indicator of colorectal cancer. Number 3. Sweet and unpleasant. The smell of something sweet yet unpleasant may seem contradictory, but for some individuals, it can be a subtle yet important symptom of advanced stage breast cancer. Breast cancer begins in the cells of the breast, typically in the milk-producing ducts or the glands that produce milk. It is one of the most common types of cancer, particularly among women, but it can also occur in men. As with all cancers, the disease begins when cells in the breast mutate and grow uncontrollably, eventually forming a mass or tumor. In the early stages of breast cancer, patients may not experience any noticeable symptoms. However, as the cancer progresses, it can cause a range of symptoms, including a lump in the breast, changes in the appearance or feel of the breast, or pain. In advanced stages, when the tumor has grown significantly or spread to nearby tissues, complications can arise. One such complication is the occurrence of infections or the death of tissues, or necrosis, around the tumor, both of which can contribute to unusual body odors. Tissue necrosis occurs when cells in a particular area of the body die due to a lack of oxygen or nutrients. This can happen when a tumor grows large enough to block the blood vessels supplying oxygen to the surrounding tissue. Without an adequate blood supply, the affected tissue begins to break down, leading to the release of various chemical compounds. The body tries to rid itself of this dying tissue through natural processes, but this breakdown often results in the release of strong-smelling compounds, which can include substances that have a sweet or sickly odor. In addition to tissue necrosis, infections around the tumor site can also produce a distinct odor. As the tumor grows, it can disrupt the normal architecture of the breast and the surrounding tissue, creating openings or wounds where bacteria can enter. In some cases, infections can occur either within the tumor itself or in the surrounding tissue, especially if the tumor has caused ulcers or other forms of skin breakdown. The bacteria involved in these infections can produce a variety of volatile organic compounds. While infections are common in many stages of cancer, in advanced breast cancer, they can significantly alter the body's natural scent, leading to a sweet and unpleasant odor on the breath or skin. In a 2018 study published in Cancer Research, researchers noted that tumors, particularly large or necrotic ones, can lead to a shift in the way the body processes glucose and other essential nutrients. This change can result in the increased production of certain VOCs, including ketones, acetone, and ammonia. These compounds are often released in the breath, sweat, and urine of individuals with advanced cancer, contributing to the unusual sweet yet unpleasant odor. A 2015 study published in Scientific Reports examined the potential of using breath samples to identify cancer-related compounds, including those linked to breast cancer. The researchers found that certain VOCs, including acetone, were elevated in the breath of patients with breast cancer, particularly those with larger or more advanced tumors. Another notable study, published in Breast Cancer Research and Treatment in 2016, explored the relationship between infections and tissue breakdown in breast cancer patients. The study confirmed that advanced stage breast cancer could lead to the development of infections, particularly in tumors that had ulcerated or become necrotic. If you or someone you know notices a persistent sweet or foul odor, especially in combination with other symptoms like unexplained lumps, pain, or changes in the appearance of the breast, it is crucial to seek medical attention as soon as possible. Early detection can help prevent the cancer from spreading and improve the chances of successful treatment. Number 4. Unexplained bad breath. If your breath has a foul or putrid odor that doesn't seem to go away even with regular oral hygiene practices, this can be an alarming symptom of lung cancer. Lung cancer, one of the leading causes of cancer-related deaths globally, begins when cells in the lungs mutate and begin to grow uncontrollably. These abnormal cells form tumors and can invade nearby tissues and organs, leading to the spread of the cancer. While early-stage lung cancer often has few noticeable symptoms, more advanced stages can lead to a variety of signs, including a persistent cough, chest pain, difficulty breathing, and unexplained weight loss. In some cases, patients with lung cancer may develop unexplained bad breath, which is often the result of the metabolic changes occurring as the disease progresses. Lung cancer, especially in its advanced stages, can cause the release of a variety of volatile organic compounds that not only affect the body's natural scent, but also contribute to an altered and often foul-smelling breath. As lung cancer progresses, it can cause the breakdown of lung tissue. When tumors grow large enough, they can create a site for infection and necrosis. This necrotic tissue can lead to the release of various byproducts, including sulfur compounds and ammonia, which are known to produce foul odors. Sulfur-containing compounds, such as hydrogen sulfide and dimethyl sulfide, are often associated with the smell of rotten eggs or decaying matter, and they are common byproducts of infections or necrosis. As the tumor infiltrates the lung tissue, it may disrupt the normal function of the lung, leading to bacterial overgrowth and infections. This can exacerbate the release of volatile organic compounds from the affected area, contributing to an even stronger, more offensive odor in the breath. A 2013 study published in the Journal of Clinical Oncology analyzed the VOCs released by cancerous tumors in the lungs and found that patients with lung cancer had a distinct pattern of VOCs that was different from healthy individuals. Compounds like acetone and ammonia were commonly present in the breath of individuals with lung cancer. Acetone, in particular, is a well-known compound associated with sweet or fruity odors. But in the case of lung cancer, it is often combined with other compounds that can give the breath a foul, pungent quality. In advanced stages of lung cancer, patients are more prone to developing secondary infections, including pneumonia. Pneumonia, a serious lung infection, can further complicate bad breath by contributing additional VOCs from bacterial metabolism. Infections often cause an imbalance in the normal microbial flora of the respiratory system, leading to the production of gases that can create foul-smelling breath. A 2006 study published in The Lancet Oncology found that breath samples from lung cancer patients contained a distinct set of VOCs that could be distinguished from those of healthy individuals. The researchers used gas chromatography mass spectrometry to identify these compounds, some of which are also found in the breath of people with lung infections or tissue necrosis. More recently, a 2017 study published in Nature Communications focused on using an electronic nose to detect lung cancer, which it did via breath analysis with an accuracy of up to 90%. Number 5. Sweet-smelling urine. This may seem odd at first, but it can happen. Sweet-smelling urine is a real thing, and it can be a concerning sign of a health issue, especially when it persists and cannot be attributed to a temporary change in diet or medication. While sweet-smelling urine is often associated with conditions like diabetes or dehydration, in some cases it can indicate the presence of a more serious condition, such as bladder cancer. Bladder cancer is most common in older adults, particularly those over the age of 55, and is more prevalent in men than women. Smoking is the leading risk factor for bladder cancer, as the harmful chemicals in tobacco smoke can damage the lining of the bladder. Exposure to certain chemicals in the workplace, chronic bladder infections, and a history of radiation therapy also increase the risk. In the early stages, bladder cancer may not cause noticeable symptoms, but as the disease progresses, individuals may experience signs such as blood in the urine, painful urination, frequent urination, and lower abdominal pain. In some cases, sweet-smelling urine can emerge as a subtle indicator of the disease. The last one happens due to the altered metabolism caused by the tumor's growth and the release of certain chemicals by the cancerous tissue. As the tumor develops, it can disrupt the normal functioning of the bladder, leading to the release of volatile organic compounds that change the composition of the urine. One of the chemicals commonly associated with sweet-smelling urine is acetone, which is produced as a byproduct of fat metabolism. In the case of bladder cancer, acetone can be released into the bloodstream by the tumor and subsequently excreted in the urine. Acetone has a distinct sweet, fruity odor that is often reminiscent of the smell of nail polish remover or overripe fruit. The accumulation of acetone in the urine, combined with other compounds released by the tumor, can lead to a noticeable sweet smell that may persist even with normal hydration. As bladder cancer progresses and the tumor grows, it can affect the function of the kidneys, which are responsible for filtering waste from the bloodstream and producing urine. In some cases, the tumor may obstruct the urinary tract or cause the kidneys to work harder to filter out waste products. This strain on the kidneys can lead to changes in the composition of the urine, including alterations in the levels of certain chemicals, which may result in a sweet odor. When the kidneys are functioning suboptimally due to the presence of a tumor or other blockages, the body may struggle to properly eliminate waste, leading to an accumulation of metabolites like acetone, ketones, and glucose in the urine. These substances can alter the urine's smell, making it sweeter than normal. A 2005 study published in Clinical Cancer Research found that bladder cancer patients often exhibit abnormal chemical signatures in their urine, including the presence of VOCs such as acetone and ammonia. Additionally, a 2016 study published in the Journal of Urology examined the role of urinary volatile organic compounds as potential biomarkers for detecting bladder cancer. The study found that certain VOCs, including acetone, were more prevalent in the urine of bladder cancer patients compared to healthy controls. These VOCs were not only present in larger quantities, but also had a distinct odor. Number 6. Fruity or acetone-like breath. Fruity or acetone-like breath is often associated with conditions such as diabetes and fasting. However, in some cases, this odor can be a sign of pancreatic cancer. The pancreas, located behind the stomach, is an organ that plays a critical role in both digestion and blood sugar regulation. It produces enzymes that help break down food and hormones like insulin that regulate glucose levels in the blood. When cancer develops in the pancreas, it often begins in the cells that produce digestive enzymes, leading to a type of cancer known as exocrine pancreatic cancer. This is the most common form of pancreatic cancer, and it accounts for approximately 95% of cases. Unfortunately, pancreatic cancer is often diagnosed at advanced stages because early symptoms can be subtle or easily attributed to other, less serious conditions. As a result, many patients do not experience significant symptoms until the disease has already spread to other parts of the body. The primary risk factors for pancreatic cancer include smoking, family history, chronic pancreatitis, and certain genetic mutations. As the tumor grows, it can interfere with the normal functioning of the pancreas, particularly its ability to regulate blood sugar and produce digestive enzymes. This disruption can lead to an altered metabolic state in the body, which includes the production of ketones, a process known as ketosis. Ketones are chemical compounds that the body produces when it breaks down fat for energy. Under normal circumstances, the body generates ketones when carbohydrate intake is insufficient, such as during periods of fasting or strict low-carb diets. However, in cases of pancreatic cancer, the body may enter a state of ketosis due to an imbalance in metabolic processes caused by the tumor. The presence of a tumor in the pancreas can lead to insulin resistance, where the body is no longer able to use glucose effectively for energy. As a result, the body begins to break down fat for fuel, producing ketones as a byproduct. One of the most noticeable byproducts of ketosis is a distinct odor on the breath. Ketones, particularly acetone, have a strong, sweet, and fruity smell. This acetone-like breath is a common sign of ketosis, and while it can occur due to benign causes like fasting or diabetes when it is associated with other symptoms of pancreatic cancer, it can be a red flag for the disease. A study published in Gut in 2012 explored the use of breath tests to detect volatile organic compounds, including acetone, in patients with pancreatic cancer. The study found that individuals with pancreatic cancer had significantly higher levels of acetone in their breath compared to healthy controls. Additionally, a 2015 study in The Lancet Oncology investigated the use of breath samples to detect cancer-specific VOCs. The study found that specific patterns of VOCs, including acetone, could be detected in the breath of patients with various types of cancer, including pancreatic cancer. Given that pancreatic cancer is one of the deadliest forms of cancer, with a 5-year survival rate of just around 10%, catching the disease in its early stages can significantly improve outcomes. When symptoms like fruity breath are recognized early and followed up with appropriate diagnostic tests, such as imaging studies, blood tests, or biopsy, patients have a better chance of receiving timely treatment. Number 7. Fishy odor. A fishy odor emanating from the body is a distinct and concerning smell that can indicate a range of health issues, some of which are more serious, including kidney or liver cancer. While body odors in general can be linked to dietary choices or other benign conditions, a persistent fishy odor, especially when accompanied by other unexplained symptoms, should be taken seriously. The fishy odor, often described as similar to rotting fish or ammonia, can be caused by the accumulation of specific compounds in the body. These compounds, which are normally broken down and eliminated by the kidneys and liver, can build up to toxic levels when these organs are compromised due to cancer. The underlying mechanism that contributes to the fishy smell involves the body's inability to detoxify properly, resulting in the accumulation of waste products like trimethylamine or TMA. This is the compound responsible for the fishy odor. Both the liver and kidneys play essential roles in detoxifying the body by filtering out toxins, processing waste products, and regulating the balance of fluids and electrolytes. The liver is involved in metabolizing nutrients and detoxifying harmful substances from the blood, while the kidneys filter waste from the blood and produce urine for excretion. When cancer develops in these organs, their ability to perform these vital functions is compromised. In kidney cancer, also known as renal cell carcinoma, the tumor may disrupt the normal filtration process, leading to a buildup of waste products and chemicals that the kidneys would typically eliminate. Similarly, in liver cancer, which includes hepatocellular carcinoma, the cancerous growths can interfere with the liver's ability to filter out toxins and regulate metabolic processes. The fishy odor that is often associated with kidney or liver cancer is primarily caused by TMA, a volatile organic compound produced during the breakdown of certain foods, particularly those high in choline, such as fish, eggs, and liver. Under normal conditions, TMA is metabolized by the liver into a non-odorous compound called trimethylamine N-oxide. However, when the liver is compromised due to cancer, this conversion process is impaired, leading to the accumulation of TMA in the bloodstream. TMA is then exhaled through the lungs or excreted in sweat and urine, leading to the characteristic fishy odor. This condition is known as trimethylaminuria, or fish odor syndrome. And while it can be caused by genetic disorders or dietary factors, in the context of cancer, it is typically a sign of liver or kidney dysfunction. The inability of these organs to process and eliminate TMA properly results in its buildup, which is then released in the breath, sweat, or urine, causing a persistent fishy smell. A study published in the Journal of Clinical Investigation in 2005 found that patients with liver disease, including those with liver cancer, often had elevated levels of TMA in their blood, which correlated with the presence of the fishy odor. Similarly, a study in nephrology dialysis transplantation in 2013 discussed how kidney failure due to cancer can lead to the buildup of various waste products, including TMA, which is then exhaled in the breath. In addition to TMA, other compounds can contribute to a fishy odor in the context of liver and kidney cancers. For example, uremic toxins, which are waste products that the kidneys normally filter out, can accumulate in the bloodstream as kidney function declines. These toxins, including compounds like urea and ammonia, can contribute to foul-smelling breath and body odor. As kidney cancer progresses, these compounds can build up to dangerously high levels. Liver cancer can also result in the buildup of other toxic metabolites, such as acetone and ammonia, which can alter the body's natural odor. When liver function is compromised, it is unable to process and excrete these toxins, causing them to accumulate in the body. As these compounds are released through sweat and breath, they can create an overpowering and unpleasant smell, which may be described as fishy or ammonia-like. A fishy odor, particularly when it is persistent and unexplained, should never be ignored. While this odor can be linked to benign causes, such as certain foods or genetic conditions, it is also an important symptom that can signal liver or kidney dysfunction, and in some cases, cancer. Number 8. Musty or foul odor. A musty or foul odor emanating from the body is not something that should be dismissed, particularly if it persists or arises without any clear cause. The real culprit can be skin cancer. In such a case, the odor is primarily a result of tissue necrosis or infection around the site of the tumor. In some cases, infection can also set in around the tumor site, further exacerbating the odor. Bacteria may colonize necrotic tissue, leading to the release of additional compounds that produce a foul or musty smell. In other cases, a foul odor can indicate that the tumor has penetrated deeper into the skin or surrounding tissues, causing more widespread tissue damage and further complicating the disease process. Bacterial overgrowth is common in necrotic tissue, and these bacteria produce various compounds such as sulfur-containing molecules and ammonia, which can emit a foul smell. As these bacteria proliferate, the odor becomes more intense, signaling that the tumor is advancing and that the body's normal healing processes are overwhelmed. Furthermore, the body's immune response to the cancerous growth can result in the release of volatile organic compounds, which are produced as a result of the chemical interactions between immune cells and the tumor. These VOCs can accumulate and be released in sweat or exhaled through the breath, contributing to the overall unpleasant smell. A study published in the Journal of Clinical Oncology in 2004 explored the role of necrosis in the progression of melanoma, a type of skin cancer, noting that areas of necrosis within tumors were commonly associated with infection and the release of metabolic byproducts, which could produce an unpleasant smell. The study found that these odors were particularly noticeable in advanced stages of melanoma. In another study published in the British Journal of Dermatology in 2007, researchers noted that patients with advanced squamous cell carcinoma of the skin, especially those with ulcerating or necrotic tumors, frequently experienced the presence of foul odors around the tumor site. A more recent study in the Archives of Dermatological Research in 2018 investigated the role of infections in skin cancer progression, particularly in the context of basal cell carcinoma. The study found that when tumors ulcerated and became infected, they emitted a distinct, often musty or foul odor. This was scary, but hopefully it will help save lives. Well, that's it for now. Thanks for watching. Did you like this video? If you did, please consider liking, dropping a comment, and hitting the subscribe button so that you don't miss out on our new uploads. Also, don't miss this video you see on your screen right now. It's truly unbelievable.